Welcome to another edition of Health Matters, a presentation by the Ministry of Health. I am Nazim Hussain, glad that you could be with us on the program. In our program today, we've got from the Caribbean Public Health Agencies. They're in Guyana for a very important mission, and they'll be telling us more about that on our program. And we've got immediately on my left Dr. Lisa Indar. She is the Executive Director of CARPHA, the Caribbean Public Health Agency. And next to Dr. Indar, we've got Dr. Sami. He's the Director of Corporate Services, and we've got way on my further left, Dr. Horace Cox. He's the Director for Surveillance, Disease Prevention, and Control Division. Ladies and gentlemen, welcome to the program, and I hope that much will be achieved. Tell us a bit about CARPHA. It's 13 years in operation. Obviously very young, but I'm quite sure you have some things that you could boast about.
Yes, thank you. And so CARPHA is a regional public health agency. We are the sole integrated public health agency mandated by heads of government to, promote and protect health for the region. Our vision is healthy people, healthy spaces, healthy environment. And as you say, we are 13 years old, but when you consider that we are amalgamation of 5 of our different regional institutions, CAREC and CFNI and the Environmental Health and the Drug Testing Lab, as well as the Research Council, we really bring over 30 years experience.
And you work in a space of 26 member states.
And we work for 26 member states.
Yeah.
So we're unique in the fact that being, there are so many public health agencies around, but we developed really for serving the region. And the way how CARPHA is approaching that, our renewed way is about developing Caribbean tailored intervention that serves the region. We are small and we are porous, highly interconnected, high dependence on tourism, and impact of climate and disasters is very detrimental to us. So it's almost like, you have an illness in one country, you're sure it's going to go because of how small and interconnected we are. So because of that, CARPHA has taken on the approach of developing interventions that really is about for the region, that is tailored for the Caribbean region. So we've had a lot of milestone achievements, things like early warning systems for emergency and response. We advance in that, where in addition to emergency and response, we want to put some alert mechanism so countries will know what's happening, immediately or in real time as possible. So you can have, rapid intervention because you don't want spread, especially in small islands.
What was a lesson learned from COVID? A young organization, up and coming, you faced COVID.
Yes, we faced COVID, and COVID is one of the reasons why we are developing some of these systems. COVID taught us that there were gaps in surveillance or in lab, in coordination. We weren't well equipped, with certain things at ports of entry and so on. So from that, we grew and we developed interventions more in surveillance, lab response, workforce capacity, and also in coordination so that we could better serve the region. But it's all about timeliness. COVID taught us we need to be timely. We need to coordinate more. We need to share information more, better. Yes.
And what would have been, you would think, in your term, because you're not there from the beginning, but since you've been with CARPHA, one of your most significant milestone achievements?
So I think one of our most significant achievements, we have a lot, but if we have to really pick out, is our advancement towards regional health security. All that what CARPHA is doing is from
Very quickly,
approach.
if you can explain for our audience, regional health security.
So regional health security is about, achieving health security across borders. You want to ensure you put systems in place in countries and regionally so that you can be able to detect and monitor spread of illnesses across borders and stop or alleviate as much as possible. So you're building the capacity to do that. So all of what CARPHA is doing is towards that. So the systems and the capacity building, as well as the lab intervention and all of that is towards that. What we would have developed, and I think it's a milestone achievement, what perhaps one of the biggest, we would have started, 4 or 5 years ago with all our stakeholders, all the countries came, as well as our agencies, and we came up with a framework. How do we do this? What are the different facets in terms of surveillance and lab and workforce development coordination that was needed? And that then morphed into a pathway. And now we are into the point where we have developed tools for implementing that pathway.
Thank you very much, there, Executive Director. Our opening segment, Executive Director of CARPHA there, Dr. Lisa Indar. Tell us all about CARPHA and some of the achievements. Stay with us. We'll be right back after these messages.
Show them all the scene. Get up to date with your vaccines. Haters talking smack about the vax, saying it's whack and lacking the facts, spreading propaganda, creating more drama, unnecessary trauma. But it's not. It's just another way to distract. So show them all the scene. Get up to date with your vaccines. With no vaccines, the virus will start to adapt. And you could get trapped with no way to come back. So tell your friends and your fam, don't slack. COVID came in hard, now we counter-attack. Show them all the scene. Get up to date with your vaccines. Vaccines save lives. A message from USAID, UNICEF and CARPHA.
Welcome back to our program. We're talking Caribbean Public Health Agency here, and they've got a strategic plan in the making with a theme, interesting theme, Stronger Together, Advancing Caribbean Health through Collaboration, Innovation, and Sustainable Action. Dr. Mark Sami, he is Director of Corporate Services, and he's going to be giving us some guidance on this strategy. It has to be a lot of work compiling this, but outside of the work, tell us a bit about the strategy.
Thank you very much. But as you would know, and as the viewers would know, the global landscape is changing. So the resources that were available, let's say 5 years ago, are no longer available. Mm-hmm. Developing countries and developed countries are more inward looking. So they're looking at their own priorities, like defense, security, energy. So as a result, the resources, financial and otherwise, that were available for regional action is no longer available, or available in small amounts. But at the same time, regional health threats are not abating. We're seeing emerging and re-emerging threats. So what we have to do is, work better, collaborate more. So as a result, we've launched our new strategic plan from 2025 to 2030 under the theme that you mentioned. And by doing that, we want to see how we can work together with the small amount of resources that we have now to ensure that we serve the region more efficiently. So as a result, we're launching the plan. We're inviting member states. Of our 26 member states, we have 24 in attendance. We have some of our regional partners, our regional CARICOM agencies, and we have all of our international development partners as well that are going to be in attendance. And at that meeting, we want to ask countries, what are your priorities? The work that we have planned for the next 6 years, what is high priority for you? What is medium priority? What is low priority? If it's a low priority, should we do it or should we not do it? Should we do it at a later time? We want to ask our regional agencies, what we plan to do. Is it something that you're doing as well, so that we can collaborate and see if you do it or we do it, or we do it together. We want to ask our international development partners what we have planned. Do you have the resources to help us to get this work done? So by doing that, we can collaborate, innovate, and ensure that there is sustainable action to support the Caribbean region when it comes to health. But not just health, because we're inviting also partners in security, in emergency response, and all other areas that relate to health as well.
We would have seen, in your past 5 years or since 2013, there have been ongoing issues as it relates, and that might carry forward into your next 5 years. What will be some of the new focus?
So the new focus, it's really about efficiency and efficiency towards sustainability. So as Dr. Sami said, there have been changes. So you had COVID, but then after COVID, you have like the re-emergence of measles, largely due to the fact that some people are being hesitant in terms of vaccination. And then we are seeing things that we haven't seen before, like influenza and so on. And then antimicrobial resistance. We are seeing that is becoming it's almost like the hidden pandemic because, of course, people are overusing antibiotics at the farm level and even at treatment. Crime and violence as a public health issue. So there are a lot of things, the impact of climate change. All of those were not in our original strat plan. But if CARPHA has to stay relevant, we have to obviously address the changing, scheme of public health. But at the same time, we know that there are many other agencies working. So how do we do it together? How do we use the limited resources, do more joint missions, do things together, reduce duplications? All of that is the way going forward. The other thing that we're doing is all about results. How do we keep persons, be more accountable? And that's something that CARPHA, is really pushing. We are saying that we are doing something for the region, whether it be an early warning system or doing a technical service. It's all about doing it and doing it on time and making sure that we are putting measures at the country level and even at CARPHA to make it sustainable, whether through the funding or through putting it as part of our normal operational surveillance and laboratory or just general operation systems here.
And if I may add just shortly, so Dr. Indar mentioned result-based management. What we're doing, we're not just measuring what we do in countries, we measure the impact. So we won't say, okay, we went to a country and we did two training activities. So what? What is the impact of that training? So that's what we're measuring. The long-term benefits of the work that we do. Not just to go and say we do something in a country but what is the impact of it?
Just to put maybe Dr. Cox on a bit of spotlight here. And, you mentioned some aspect of the focus in terms of disease and so forth. And Dr. Cox, of recent time, but not very recent, but for a good while, mental health and cancer has, seen a rise in Guyana. Would that be something that CARPHA will be looking at in the coming years?
Oh, thank you very much for that question. And just to answer directly that yes, in fact, it doesn't even have to come to the launch of the strategic plan. These are activities that we implement as part of our chronic disease and injury program at the Caribbean Public Health Agency. And in fact, the Health Research Conference, which was held this year in Barbados, the theme was mental health, the hidden pandemic. And so CARPHA being an evidence-based organization, you see the focus that we put in terms of gathering evidence to guide policies tied to mental health. And where cancer is concerned, we particularly focus on cancer registries across the Caribbean region and providing technical support to different member states in this regard. So the reality is that even though we speak a lot of infectious diseases, ultimately the non-communicable diseases, factoring in mental health, as well as cancer, we've noted that those are of significant importance and require our attention as well. And just to say, as was mentioned earlier, it's all about the tailored to context approach. And so what we're advancing would be activities that are tailored to the member states' context. And so even for these two particular fields, we look forward to continue to collaborate with member states.
Both for Dr. Sami and the Executive Director, obviously, you're talking about strategic outcome, and you're not merely looking to just tick a box and say, hey, it's got to be impacting. It's got to have ripples, not only where you may have, high prevalence, but also knowing fully well that we are traveled, and that's how COVID would have spread, and that it could affect others. How will we not go about ticking the boxes, looking at strategic outcomes based upon this new 5-year strategy?
Well, we have some measurable indicators from an M&E monitoring evaluation point of view. We have some very robust indicators. So we use those indicators to measure how effective we are. And as a matter of fact, we report on a regular basis. We have various governance mechanisms. We have an advisory committee. We're meeting on Friday. We have our executive board made up of ministers and permanent secretaries, etc. We report to them. We have our council of social development, of health and social development, with all of our health ministers. We report to them as well. So we show the impact of our work based on those indicators and how well we're doing. Are they on track? Are they not on track? Have we achieved them? Have we exceeded them? So we have that layer of governance for the work that we do to keep us in check as well.
And I think part of it is our, I don't want to say our new, but maybe our renewed trajectory about serving the region. We are about working with the countries, and we are very clear that our job is to provide technical service to the region. It may be tailor specific because it's for what you might do with a small country like Montserrat. Might be different from Guyana because, you just have different infrastructure and systems. And then when it comes to the region, we know that we have to produce goods, we call them regional public goods, that a country can take and be able to run with it. That has to be easy to use, adaptable, accessible, and all of those different things, confidential, like if it's travel, health, illness, and so on, so that we are better serving the region with whatever context the country may have as well as the region may have.
Dr. Cox, any further input on impacts and benefits out of these strategic areas that will be coming up in the next 5 years?
Yeah, perhaps just to end on the point, as the ED mentioned in the opening remarks, our focus as a public health agency is on health protection, promotion, and of course, preventing diseases. So ultimately, going back to what Dr. Sami would have mentioned, the indicators are there, and we have targets, and importantly, a framework is being built where we hold ourselves accountable and set a very high standard in the interest of satisfying our objectives. So I believe that when it comes to impact, it's not just waiting until we finish the process to assess, but also we're doing, apart from monitoring as we progress, but we're doing mid-period assessments to see how we progress in that regard. And of course, it includes flagging risks.
ED, challenges. Do you foresee, a good manager, good forecast, you foresee challenges, small or big, in the next 5 years?
We're always going to have challenges.
Right.
It's how you deal with them, right?
Right.
We always have
and
challenges.
does that strategy have
Yes.
a built-in
Yes.
component, and that will take care of that snap of the moment?
Yes. And the thing is, it all comes to first, getting everybody on board
Right.
and getting that vision in, which is what we're doing. Part of our transparent way is not just working internally at CARPHA, but having these meetings this week. It's getting our countries involved, and then we take it to a high level, getting our ministers involved. The next chair of our council is going to be Honorable Frank Anthony. How do our ministerial support what we go through? Challenges of funding, maybe duplication, varying visions, or different visions are always going to come. But how do we, get in even sometimes a country buy-in? It may be a challenge, but I could say with confidence that the way how our strategic plan and the way how we are moving, that we working towards, I'm confident that we are actually addressing those challenges. Yeah,
That's great. So stay with us. So we'll be right back after these messages. We'll have more to talk about with the Caribbean Public Health Agency. They're here in Guyana for almost a week. Don't go away.
Show them all the scene. Get up to date with your vaccines. Haters talking smack about the vax, saying it's whack and lacking the facts, spreading propaganda, creating more drama, unnecessary trauma. But it's not. It's just another way to distract. So show them all the scene. Get up to date with your vaccines. With no vaccines, the virus will start to adapt. You could get trapped with no way to come back. So tell your friends and your fam, don't slack. COVID came in hard, now we counter-attack. Show them all the scene. Get up to date with your vaccines. Vaccines save lives. A message from USAID, UNICEF and CARPHA.
Welcome back to our program. We've seen some countries in the Caribbean and Guyana, and of course Suriname and so forth, will have almost a sudden increase in population. And so it will be costly. Countries reaching out, migrants. And that was not something we were familiar with 3-4 years ago, as the case may be. And now this is going to be a little, burden, for want of a better word, on implementation of strategies, language barriers and so forth. It has to be done in a sustainable way, and sometimes funding. We've seen funding cut in so many parts in this hemisphere. How is CARPHA intended to sustainably serve the region, given all of the dynamics?
Right. So I would start, of course, and Dr. Sami and Dr. Cox will jump in. But in developing our strategic plan, we thought about all of this. looking at the whole big picture. And so we would have developed sustainable mechanisms as well as, innovations for sustainable financing, as well as the partnerships, because you need all three. You need to work together, you need to be able to survive and to have funding to do it. But the mechanisms we are developing, it's all about being innovative, being more resilient. That takes into account not just our normal population, but we call them, whether it be a visitor population or our transient population. It might be migrants, it could be travelers and all of that, but we're taking into account all of that.
Just add to what's been said. So when we speak of sustainability, so you did mention an important word, resilience, right? And there's another component, which is how responsive are we to the needs of the population and to the needs of member states. So when you look at resilience, that would factor in several things. Are we prepared to deal with the issue that's coming? Do we have the necessary intelligence from an epidemiological perspective? And that goes back to the whole concept of the first meeting of this week, which is regional health security. And as persons would know after COVID-19, you alluded to it earlier, the reality is that Guyana and many other member states had to bounce back. And so this was a shock. And so CARPHA works with member states to ensure that there is resilience. And the other component being responsiveness. So to ensure that whatever comes up, we're able to address it. We heard words of efficiency, effectiveness, and being able to roll out interventions in a timely manner. So from our perspective, in the strategic plan, as we encapsulated it, we really feel that when we speak of sustainability of interventions, those two components are particularly critical.
And if I may add as well, I'll throw another R into the mix, the R of relevance. Because we are aware, we're not the only public health player in the region. We know that. So we have put several mechanisms in place to ensure that we are more relevant. For example, one of the major functions that we execute for countries is lab testing. And in the past, countries had to send their samples to Trinidad lab to test. Now we've boosted the St. Lucia lab as well as the Jamaica lab. So OECS countries can send their samples now to St. Lucia to test instead of Trinidad. And even countries in the north that had issues sending samples to Trinidad can now send to the Jamaica office to get their samples tested there. So we've boosted our relevance in that area and many other areas. But to add on the sustainability part, as I mentioned earlier, we are seeing a dwindling of funds in the global landscape. And for us, not just CARPHA, but many of the CARICOM agencies, we depend on donor funding to execute our activities. And with those funds being reduced or no longer available, we have to look at innovative ways. And one of the major ways that we're looking at is the collaboration. So that the small funds that 5 agencies have, we can put those together and get the work done instead of one agency doing it alone.
Sometimes we look at, and I'll put you in the spotlight here, Madam Executive Director. There's sometimes, we come with our, personality into it. And just as how CARPHA is young, you two are very much young into your job as Executive Director. How do you see your role in moving forward 5 years and beyond in this whole Caribbean space?
Yeah, so that's a good question. I see our role as being, persuasive, to be providing whatever technical inputs that are needed, but also to be an impetus to say that, nothing is stagnant. It's all about change. And change means early warning systems. We can't rely on present systems that says, okay, just calculate, collect data, and then in a month, give a result or a trend. We need to be able to work with our countries to get information to them now, immediately, so that something is happening in one country before a traveler or before it actually gets to another country. We are supporting that. Dr. Mark spoke about how we are expanding through our labs. So we're making services accessible faster. You can test faster. And then there is a whole thing about the partnerships. We have to work with the partners. So one of the things that our office, our executive management team is embarking upon is to really work with our partners, to work better, to coordinate more. And I think that's going to make the difference, where they see CARPHA being relevant, they see CARPHA being more efficient, more effective, more transparent, and we can serve as an impetus to and encourage the rest of the member states and the countries to come with us, come along with this. I want to say, come along with this ride for us as we are better serving the region.
As we wrap up our program, time is out. It's one of the R's that we talk about is research, research, research. CARPHA is doing that. Tell us a bit news. The research conference next year as we wrap up.
Yes, so CARPHA has the longest running health research conference, and next year we are having the 70th in Guyana, and the topic is innovations in health, which is of course very, very applicable, and we see it important to have it in Guyana, but 70 years, that's huge. And so it really speaks that the importance of operational research to guide what we are doing. And we will continue like that. We would have had different topics, but the innovations in health is meant to look at all these different, not just innovations, but sustainable mechanisms that is applicable to the region, what is happening globally, and how we can take that, apply it, make it better for the region.
Ladies and gentlemen, Executive Director for CARPHA, Dr. Lisa Indar, Dr. Mark Sami, Director of Corporate Services, and Dr. Horace Cox, Acting Director, Surveillance, Disease Prevention and Control Division, have been our guests on Health Matters on today's program. Thank you very much for being with us. Let's hope for the next 5 years is going to be the best for you. I'm Nazim Hussain. Do join us again next time. Until that time, stay well.